So we say, while in the pathology class, what means pathology? We learn the illness. The illness happens in the cells level first. So that's firstly, we're talking about the cells injury. When after cells injury, multiple cells injury, then cause the tissue injury. That we call inflammation. So after injury, whatever cells injury or locally injury, after injury, our body need healing. So that's we say, we're talking about healing today. Healing. Firstly, we're talking about what means healing. So whatever happens by the pathology reasons and damage the local tissues, our body some reactions and try to replace of the dead tissues by the living tissues. So for the simple words, we say, just try to recover normal tissue, structure, and function. So that's we say healing. So process of healing. So we have different type of the healing. The first type of healing, we name it regeneration. What means regeneration? Means the tissue recovered totally the same with originally their tissue there. So whatever they lost, they recovered totally by the same cells and tissues. We can call this kind of healing is totally recovered kind of healing. That's we accepted. That's we expected. That's best giving way. Another kind of healing, we call it repair. So this kind of healing basically is healing by scar tissue. It is still healing. It is still healing for like some tissue damage there. But so they coming with some, like we just talking about, chronic kind of inflammation. They will form some tissue, some epithelial cells in there first. And also later on, they may just form by the scar tissue. So generally say they recover by scar tissue. So the second healing, we give it a name is repair. So we use different name for different kind of healing. One is regeneration, exactly healing by original tissue, and the second one we call it repair. It is healing by the fibrosis, so that generally can recover most part of the tissue's shape, but basically they will not recover original tissue function because the fibrosis, they don't have special functions, they don't have special cells there. So that's the process here. Tissue injured first, tissue injured or damaged first. After injured or damaged, they got inflammation. After inflammation, inflammation we say we have acute one, we have chronic one. But it both need to healing. So after inflammation happens, our body will go to the healing. So this part belong to healing. The healing process need to remove the dead tissue and remove some injured agent. For example, some bacterial infection or virus infection. We need to remove it. And then we are healing by two different ways. The first way we expected, we call it regeneration kind of healing. So recover damaged tissue by special kind of tissue or original tissue in there. That will have special functions. The second kind of healing, the healing the tissue by the fibrosis. That's generally is scar tissue. But whatever, it belongs to healing. So that's we say these two belong to healing. But regeneration kind of healing or repair kind of healing, result is different. Regeneration kind of healing totally recover the tissue's function. But repair kind of healing just recover the form or shape, but they losing some functions. Then we go to some detail to these two different kind of healing. The first way we talking about the healing by regeneration. Healing by regeneration, we say that we expected. It's totally use the new tissue recover the damaged tissue or damaged cells. Recover by specially original tissue or cells in there. So basically, it happens. It starts from some cells like divisions. One cells make two cells, and two cells make four cells, and then 8 cells, 16 cells. Certainly we have some damaged cells in there. We need more cells to recover. And these kind of cells, they go to surrounding loose tissue area and replace the loose tissue cells. And the second step, so basically these kind of cells just go to the empty space. Tissue dies, the space will be empty. So that's two steps for regeneration. And repair. And repair. Also we call healing by connective tissue or fabric. Connective tissue mainly is fabric in there. Just a small amount of the cells in there. Like last semester, especially then connective tissue, we have different types. So basically, it still can repair, but basically they losing function kind of cells. They just repair by the fibrosis. They repair by the connective tissue. And finally, this kind of repair form the scar. This kind of scar tissue can happen in the skin. That's mostly we can see it. Pretty common. We see some people in some part of the body, they have a scar tissue. They may got injured before, or even they may got surgery before. They may cut themselves before, and then we can see a scar tissue. Then we especially go to talking about if damage for the skin, that's usually that kind of injury we call wound. So that kind of healing, how it happens. And we say we have two different kind of healing, and happens in which, like what kind of conditions. So we're talking about the wound contraction first. So that's basically like if we're cutting ourselves, damage part of the bodies, and then the contraction first. These kind of contractions, basically they will reducing the size of the injured area. So pretty effective. Can reducing the wound size about 70 to 80% with its original size. So this process truly can be faster, help to healing. So that's basically the first reactions for the tissue if they're injured. If they try to healing, the firstly they will contractions and make the injury or damaged getting smaller, and then the healing. So if some part, like some part of the body we have more bone in there, and if not able to contracture in there, the healing process will be very slow because it's a big wound in there, and later on will be scar tissue in there. So that's the first step. And then we talking about what's caused the wound contraction. The wound contractions. So that's we say we have some special kind of cells. Basically, they form kind of muscle cells, and they can contractions. So that's usually happens pretty fast after 2 to 3 days after injury, and more cells go to around wound area and then cause the contractions and reducing the size. So that's basically cause of contractions. And then we go to the healing. So when they go to the healing, we say we need some special kind of cells and replace the damaged or injured cells. So some cells affect the healing, or can we need to clear the damaged cells. Like some cells is damaged, we need to clear it. Then we have some new cells that can come later. So basically, we have some cells will go to locally and help to healing. Platelets mainly function stop bleeding. So that's basically or inside of the some tissue is damaged there, like inside blood vessels, some cells damaged there, they will be activated. We know all blood vessels go to all over the bodies. So any part we have tiny small blood vessels. And if we damage our skin or tissues, you must be damage some blood vessels. You must be damage some cells inside blood vessels. So directly trigger the platelets. Platelets have two different shapes. So normally they are in the inactive kind of shape, pretty smoothly and small. But if they trigger by the cells damaged, they will be active. Then they will change shape to bigger and irregular shape. Then more and more platelets they together. So in this way, mainly functions stop bleeding. So that's some cells in there. And when wound damaged, epithelial cells will be damaged in there. So that's local area, some epithelial cells will be damaged there. And more blood circulation brings some protein go to local area. And we say we need clear cells or eating cells will be clear the damaged cells and leaving the space for the new cells coming. And also we have some lymphocytes, lymph cells will go to local area also. So that's lymph cells will kill the pathogens and help the healing. So that's the basically we're talking about during injury, during healing. So all the cells will be removed and the new cells will be coming. So basically if we have wound like this, so some dead tissue here, and the cells will remove the dead tissue, and around the injured part, some new cells will be growing and getting more and more and more, and finally recovered. That's we talking about regeneration kind of healing. It's totally recovered with original cells. When it recovered with original shape in there, they will be stopped. They will be stopped. So that's normal reaction. Some abnormal reaction, they are not stopped. They still continue. Some new cells coming. That's some situation, like some tumor or even cancers, maybe happens. Then we go to healing of skin wounds. Yeah, healing of skin wounds. So these kind of wounds possible by accidents, possible by surgery. So these kind of healing possible by regeneration, possible healing by scar tissue. So they depending the nature or maybe the size of the wound. So we have two patterns healing. And these two patterns, their result will be different. For the skin wound is the healing. We say that's basically possible have two different kind of healing. The first kind of healing we call it by the first intention, and maybe healing by the second intention. So let's see what means the first intention, what means the second intention. So generally say, first intention is a kind of a regeneration kind of healing. Second intention is kind of a repair kind of healing. So first intention. Yeah. So during first intentions, it happens pretty faster. Within 24 hours, we have some neutrophil cells will go to local area. Like where you have wound, they will go to local area. You can see a lot of cells around the local area here. And then some in this area, their reactions, they try to healing. They go from side of the wound and then moving, go to the center. And gradually new cells is coming. So that happens during 24 to 48 hours, like second day to third day. 1 day, second day there. Epithelial cells go to there also. So that's basically happens first. And then the third day, some neutrophil cells will get some replaced by another cells, macrophage cells. That's usually we talk about the eating cells in there. And some last we talk about in chronic inflammations. Yeah. Thus, basically, the tissue mixes with the dead cells and new cells. Thus, go to that space also. So, some means some healing start. And then, later on, more and more cells face the space. And the epithelial cover go to normally cover it. So just like the video show us. So basically after about a week or maybe 2 weeks, the tissue can be totally recovered. Yeah, can be totally recovered. So we may still have some fabric is under, but you can see the above part basically recover by the normal cells in there. So that's we say epithelial cells cover our skin normally. So basically, if healing by first irritation, basically they can recover exactly the same like before the injury. So that's the first intention. First intention. And what means the second intention? Second intention, that's basically the wound may be bigger or maybe in irregular shape. So that makes the healing difficult. So that's when it happens. So like big tissue is dead. And we still have cells migrate to wound area. But truly, because it's too bigger, it's pretty hard to totally recover. So that gradually you can see still some healing happens in there. But because it's too bigger, so they couldn't fill the old space. So basically they have more fabric tissue there and less epithelial tissue there. Make it pretty narrow there. And you can see, truly, we can see they are not in the same level with original skin there. And also by the wound contractions. So that's basically is kind of healing by the some scar tissue under and not smoothly kind of wound healing. So that's the second intention. And the time much longer compared with the first intention. So that's we especially talking about the skin wound healing process. Yeah. First intention and the second intention. So something affected the healing. Certainly we like the wound healing by first intention because that's the best healing. And also after healing, you couldn't see like a changing in there. But it's not depending by us. Something affected the healing type. So basically affected reasons. We have some local reasons. We have some general body reasons. Let's talk about the local reasons first. Decided what kind of healing by the type of the wound. What means type of the wound? like the wood is no bacteria in there, no virus in there. It's clear kind of wood. That's basically by the surgery. Otherwise, any kind of other wood will have bacteria or virus in there. Because normally, bacteria and virus, they will live in our superficie of the body, on our skin. So skin is the good protection in there. When skin broken, the bacteria or virus, it must be go to the wood. So that will go to first healing. And the bacterial kind of wood possible go to second intention. And certainly first intention healing faster. So that's the first one. Second one is the size. Small wood healing faster, mainly by first intention. And the second healing, usually the size, wood size is bigger, and the cells or tissue size will be more. That's difficult to healing. And also the shape of the wood. Irregular kind of aging is hard to heal. Regular kind of aging is easily to healing. And also location of the wood. Location of the wood. So that's we talking about some part of the wood. It's more blood vessels go to there. More nutrition go to there. That's easily healing. Some part is poor blood supply go to there. It's difficult healing. So that's something relationship with how wood healing. And some area like J skin are touching the bone in there. Truly, that kind of part, the wood contraction is limited. So that kind of part is hard for healing. So that's basically first aspect. Second aspect, how much blood vessel go to local area. We talked about a little bit before already. So more blood supply go to there, more nutrition go to there, it's more easily healing. Small blood supply go to there, it's difficult healing. And also, yes, go ahead. Yes, truly. Face have more blood vessel supply there. If they injured, they got more bleeding coming from the face. But there's a pretty short process to bleeding. Then muscles contractions, then platelets will go to there. They will stop bleeding, and later on they help with healing. But foot, they blood less, but their muscles is not that easy contraction, and less blood go to there. It's a slow healing process. Yeah, you're welcome. And also we talking about like infections. Like a local wound, more infections is difficult healing. More difficult healing. Because the infection kind of wound, they kind of continually damage local tissue or cells in there. And the movement. What means movement? like some wound close to the joint area. Like people, it must be moving for the joints. Or maybe some people injure themselves. It's pretty wood in there. So when you're moving your limbs, like the wound, they start healing in there already. But by the movement, they like moving the tissues in there. That way is hard to healing. So basically, yeah. So wound healing, they by the different factors infected for local reasons. Yeah, for local reasons. Lot of things affected the wound healing. So we're just talking about something affected with wound healing. We just finished the local infections, like a different type, different size, and the location of the wound, and how many blood supply go to locally, and maybe they have infection there or not infection there, or maybe it's kind of movement in there. Then we're talking about the like general body conditions. That's we say systemic factors. So body condition affected of wound healing also. Like the circulation system, their functions. So certainly more blood circulation to the locally is more easily to healing. And also infections. Infection here we are not only talking about the local infection. Some local infection may be some like a passenger invading internal body and possible go to blood inflammation or infections. Yeah, blood. So that's possible is most severe kind of condition for the healing. It's difficult healing. And metabolism. And some hormones reasons. Nutrition. Yeah, poor nutrition is difficult to healing. Protein deficiency. And vitamin deficiency. And mineral iron deficiency. That's will affect of healing. So lot of body's condition. And also some medication affected with the healing. So generally we say both local condition and whole body conditions will affected of the healing. So we say wound healing, most case, after healing, especially when we talking about the first intention. After healing, the tissue totally recovered, nothing left, yeah, no complications. But truly, some kind of wound healing, they may cause the other issues. So some common issue after wound healing or during the wound healing, infection. So originally it's wound in there, but the patient has some conditions. It's pretty slow healing. it can cause the bacterial infections and cause the more severe kind of condition of the skin tissue there. So that's possible happens. When we're talking about all body condition, we're talking about metabolism. The more directly relationship is patient have diabetes. So diabetes kind of patient, if they have a wound, pretty difficult to heal and pretty easily cause the infection because their blood sugar levels usually pretty high. And the sugar level higher is pretty easily to help the bacterial growth. That's the nutrition for the bacteria. So that's some body's conditions affected of the like a local wound healing. Infections. Infection kind of wound is difficult to healing. And also wound not healing will cause the infections. And after healing, they may form one kind of situation, deficiency scar formation. That means the skin tissue, they form like this. They losing some part here. So that's one kind of situations. Another kind of situation we're talking about excessive scar formation. So what means excessive kind of scar formation? It means after healing, they got more tissue here. So that means excessive kind of scar formation. And also excessive contraction. Excessive contraction, basically it formed the shape pretty similar like the first one. Yeah. Still not smoothly healing there. And all the circulation can mix together. So that's the things relationship with the wound healing. The wound, basically we're talking about damage in the skin. So that's we're talking about the wound happens in the skin. They have two ways healing. That's we especially talking about first intention or second intention. It's totally depending how bigger of the wound and the condition of the wound. We expected for the first intention, but if the wound is too bigger and got the infection in there, or maybe the patient's body's conditions is not good, like poor nutrition and diabetes, that's truly possible get second intentions. So that's something happens in the skin. Something happens in the skin. When we're talking about healing, happens in the organs. So the organs cells still possible get some damage. So organs healing is depending like which organ they got damaged. And most organ, they may just healing by fibrosis. We say most organ. And that's basically we say by fibrosis kind of healing, that's only recover the shape, but not totally recover the cells, original cells in there. So that may be caused they losing function. But still depending, like we talking about lung infection, that's kind of cells injury and cells death in there. Then cells healing, after healing, they can totally recover. But mostly chronic illness, even happens in the lung, still possible got some fabric in there and still affected the organ's functions. One organ pretty commonly cause the fibrosis kind of killing. That's our liver. So liver pretty easily to damage by the chemical, by the drugs, or maybe virus. Like we talking about hepatitis. We have hepatitis A, we have hepatitis B, and hepatitis C, or even D and E. We have 5 different kinds of hepatitis. So that's infections happens in the liver. So generally say hepatitis A and C, DC not that common. So ABC is common. AC is not cause chronic problems, but truly B, hepatitis B, pretty easily cause chronic problems, chronic infection in there. And later on, gradually they happens, cells damage, cells injure, and the cells recover, happens same time. That's we say chronic inflammation, cells damage, and the cells repair happens same time. So long term later cause the problems. Some fibrosis will be happens inside of the liver. So that kind of condition is very severe kind of condition. That's truly liver losing functions, liver losing their function. And the severe case later on can cause the cancer and the people possible death. About the organs, certainly some fabric kind of changing can happen in other organs also, but liver is the most commonly organ with the fabric tissue instead of the normal tissues. Then we're talking about the bone. Bone after injury, bone after injury, and the healing in the bone. That's pretty perfect healing there. By the regeneration, we say when we're talking about healing, we have 2 different kinds of healing. One kind of healing we call regeneration. That's perfect healing. It repairs, it fixes the tissue, by original cells. And the second healing we call it repair. That's just the special words we use. Repair repair means we fix the tissue by the fibrosis. That kind of healing is kind of scar tissue formed later. So luckily we have one tissue, bone tissue, especially they can healed by the regeneration. Means after regeneration, totally recover originally the bone tissue and recover totally functions. So that's kind of healing. We call it fracture healing. That's basically we're talking about healing happens in the bone and by regenerations. So we may heard about a lot of cases. Some people injured the bone and broken the bone, and after healing, it's pretty stronger in there. Even they'll be more stronger compared with the original bone. So like a patient have second time they injure their bone, but generally say they will not happen exactly in the same place. They may happen in other place. That means that kind of healing make it even more stronger in there. So then let's see what happens after bone injury and what kind of healing process in there. So the first leg after bone injury. So certainly some blood vessels will be damaged or injured. So that's blood will go to there. The blood will go to there. So form a blood kind of swollen in there. So for example, that's the bone and broken here. So blood vessels same time will be broken, and some blood go to local area. So that's generally we say some people got pretty swollen in the local area, just like inflammation. It's blood go to there, blood protein go to there, and some liquid go to there. Local swollen, redness, painful, like we talked about local inflammation before. So that's blood go to there, then inflammation. So that's some fluid go to there, and some clots go to there. So clots basically coming from plasma protein and the platelets. So that's the way, stop bleeding. So locally injured, it must have some blood coming out, and that's the bleeding. So platelets and blood protein, plasma protein will go to local area and form the clots and stop bleeding. And certainly, local some damage will be happen because our bone broken there. Will have some dead cells in there. So in the stage 3, we still talking about these special kind of cells, cleaner cells or eating cells will go to local area. So that can remove some dead cells and can remove actual some fluid in there. Even can remove some red cells in there and remove some clots in there. So basically, they remove everything and prepare for the new cells coming. Then we say stage 4. Stage 4 is the time forming some granulation tissue. So granulation tissue, we especially talking about when we talking about chronic inflammation. Chronic inflammation. So that's the tissue have some dead cells in there and also some new cells in there. So that means follow some old cells, dead cells is broken and be removed, and some new cells will be coming. So these kind of new cells coming from the cover of the bone. So that's truly from the new bone cells in there. And these kind of new cells, they connected each other. They connect each other. So that's talking about still the bone broken in here. And then swollen in here. Then some new cells gradually coming and form kind of connection there. So they connected each other and form some fabric first. Gradually, it will be used the bone or cartilage instead. Certainly from the beginning, just a pretty thinner kind of bone in there. And gradually, more calcium go inside. They will be changing from cartilage and changing to the bone. Finally, the bone will be formed there. But generally say, they generated the cells is more compared with the original bone in there. It's not formed. The last stage reformed. So that means they can remove some actual bone cells or tissue and get a perfect connection there. So that's the last stage. But I think everybody know after bone broken, usually you need to see the doctors or maybe take an X-ray. You need to see the bone shape there. So if they like a dislocated shape like this, if we are not corrected, later on they will fix like this way. And even after form, they still not exactly with originally the shape there. They will form an angle there. So that's basically we say after bone injury. The important, we need to get the bone and the bone, they must be in the same line. We may have some space between, but we must keep it in the same line. After they fixed, they will like totally recover for it originally shaped. Otherwise, they will form an angle. So bone is the perfect tissue. Perfect tissue. They can like healing by regeneration. They truly can totally recover originally their shape and their functions. But it's not old tissue like the bone tissue. So bone tissue truly is specially